from the Cancer Caring Center, and we are excited to have you tonight for the Medical Marijuana 101. And this is our joint venture, our first joint venture, and hopefully we'll have a lot more with Bloom Foundation Gives. Erica Rich is with us here tonight. Wendy Myers is from the Cancer Caring Center. She's with us tonight. And then we have our speakers, Terry Crow and Heather Zuzo from Maitri Medicinals. We hope to teach you a lot, and if you please wouldn't mind muting yourself just so that we don't have a lot of interaction. And we are recording tonight, just so you know. If this is your first time with the Cancer Caring Center, welcome. I just wanted to share a little bit about what we do. We are a 33-year-old nonprofit in the city of Pittsburgh, because I know some of you are from out of town. I got emails from folks today. We provide emotional support for cancer, all types of adult cancer patients. So, and I'll just give you a quick look at our, what we offer. Let me share the screen real quick. And these are, if you can see, just kind of a quick overview of what we do. We offer free private counseling. Everything is on Zoom or over the phone right now. We have one-on-one counseling, which Wendy will tell you a little bit about, with individuals, couples, families. We also have a variety of cancer support groups, 32 throughout each month, a general support group that meets every Wednesday at 5 o'clock. You know, a newly survivor cancer support group, ovarian, brain tumor, African-American, a variety of women support group, and breast cancer support groups, metastatic, head and neck, GI, a lot of caregiver groups, if you fall into that category, and support groups. And we also have a wonderful group called Cognitive Toolbox, which helps you with if you're having any kind of cognitive challenges during or after treatment. We also have a lot of wellness programs, nutrition classes once a month with an oncology nutritionist, gentle movement and breathing with an oncology yoga teacher, taking control of you, which was physical therapy, occupational therapy, and speech therapy, which is twice a month, and a new integrating energy healing class, which is will start in May. If you live in the state of Pennsylvania, we can do a free will, power of an attorney, and advance directive for you with our joint venture through Reed Smith. So you can just email us at cancercaringpgh@gmail.com to get more information on any of these. And then we also just have recently, we have always partnered with the Pittsburgh, Greater Pittsburgh Food Bank, but they now actually have a special program for cancer patients. So if you are interested or in need of that, please let us know. And then I will turn that off. But I just then, so I'm just grateful that everybody is here. I hope that you can learn a little bit. I know I'm excited to learn. I will turn you over to Wendy Myers now. She is the Director of Counseling at the Cancer Caring Center.
Welcome, everyone. It is so wonderful to see this great turnout on this wonderful evening, because we wondered, because it comes out in Pittsburgh, but this is an important topic, and certainly medical marijuana has been around for a while now, but the topic tonight is going to be even more specific, and I think more helpful to all of us to educate us and understand. A little bit about myself, right? I am the Director of Counseling at the center. I am a licensed clinical social work, have been in medical social work for over 30 years, have been at the center for about 13 years as the Director of Counseling, where I do individual counseling, couples counseling, and family counseling for anybody that's dealing with cancer, anybody that supports somebody with a loved one with cancer. Also facilitate a metastatic cancer group, and as well as a grief support group for people that have lost loved ones to cancer as well. You know, the subject is near and dear to my heart, just because I think that a lot of our focus and our programming and what I do with counseling is about quality of life issues, right? Because we have had some great technology our quantity of life now with cancer, but quality of care. Quality of care is really important. And so certainly medical marijuana is part of that wellness program. You know, how do we utilize it? How do we reach out for it and understand to use it. So we're excited. Jen and I are both very, very excited and honored to partner with who's, somebody who's near and dear to our heart, which happens to be Erica Rich. And Erica, I have, a little bit of information to you about her wonderful foundation, which is the Bloom Foundation that she started. And I'm just so proud of her, as is Jen, for everything that she's done dealing with her own illness and being able to reach out to people and have 40 metastatic disease, right? So her mission at Bloom is to raise awareness and funds and to provide resources for breast cancer patients and survivors to help enhance overall well and quality of life. She also began this organization with her sister. So it's kind of near and dear to her heart, and she'll tell you a little bit more about that. They provide resources in a community that encourages practicing daily healthy habits to obtain better physical and mental health outcomes. As a result of overall health, we are able to have fun, so that instead of just surviving, patients and survivors are thriving. So with that, I'm going to introduce Erica Rich.
Thank you, Wendy and Jen, so much. I'm so excited. This is my first time hosting one of these with my non-for-profit, and very fitting topic. I definitely advocate. And just a little bit about myself. I was diagnosed with stage 4 breast cancer at the age of 25. Now 27. I am living my best life still. Right now, currently in the middle of chemo, waiting to meet with Dr. Bresky on Thursday. Fingers crossed everything goes well. But this is a big topic for me. I've always been a recreational user. And then after getting diagnosed with cancer, I started using it more as a numbing effect. And then after my oncologist prescribed it to me, it became more of a healing and a medicine. And I'm so excited to have Terry and Heather joining us today from Maitri to talk more about the healing benefits, because it's definitely something I wish I would have known a lot earlier on in my cancer journey. And it's just truly been so beneficial. And I've been able to use a plant more than pharmaceuticals and stuff. So with that being said, I'm so excited to introduce Terry and Heather from Maitri Medicinals, which is my dispensary that I've been going to. They'll have a little bit of a presentation for y'all to go through, as well as just some awesome knowledge. And then we'll try and save the last 30 minutes for questions that you have. If you want to put those in the chat, you can go ahead and do so. But just a little bit about Heather Zuzo. She is a registered pharmacist practicing at Maitri Medicinals. She is from Pittsburgh, PA, and graduated from Duquesne University in 1993 with a Bachelor of Science degree from the School of Pharmacy. Her passion as a medical marijuana pharmacist comes from her personal history with it during breast cancer treatment, and hopes to educate women about incorporating alternative medicine into their regimens to improve their quality. And then Terry has been practicing 25 years of pharmacy experience in community, hospital, specialty, and pharmacy sales, where her career has focused on 3 components of clinical HIV practice, pharmacy management, and improving the accessibility of preventing health services and educational programming in the underserved communities. Terry also has her own personal experience with her son, who she lost to opioid use overdose or disorder. And because of that, Ryan is her why. And because she found her home at Maitri, she's been able to extend her experience in literature and learning about the endocannabinoid system, which we'll learn about more later, as nature's harm reduction system. And then she dedicated this half of her career to her son, Ryan. And with that being said, I'm going to take it to Terry and Heather to go ahead and present, and I'm going to mute myself. And go ahead, take it away, ladies.
Okay. So where do we find our slides?
You know what, Heather, you are going to echo if you don't disconnect your other device.
I think I just did. Okay, I got you now.
You're perfect. Great.
Okay. Where would we find our slides? Did we share the screen? Oh boy. Okay.
Can you see
Okay,
the
Terry,
slides?
want to start?
Terry?
Oh, let's try that again.
Okay, here we go.
Hi, everybody. It's really great to be with you today. My name is Terry Crow, and I'm the Director of Pharmacy at Maitri. Maitri is a vertically integrated cannabis company. We have 2 dispensaries in Pittsburgh and 1 in Uniontown and 1 in process in a secret location. So we're really excited to talk today a little bit about the dispensary process of care and what that feels like or looks like when you first come in as a patient. Can I move that slide? Yep. So some of our company culture and key values really are around integrity, diversity, leadership, excellence, and patient-centered care. This is our Uniontown dispensary where Heather works out of. As you can see, it's a pretty welcoming, nice, relaxing environment. And then the next slide is the Pittsburgh dispensary in East Liberty. And again, another fantastic environment. So we do really try to focus on the medical component and the patient education. So just a quick disclaimer, medical marijuana is legal in Pennsylvania for medical use, but it's still a Schedule I controlled substance. Therefore, Schedule I substances are considered to have a high potential for dependency and have no accepted medical use. So cannabis is not FDA approved for any condition. And I will remind everybody that smoking or combustion is not an approved form in Pennsylvania. So what we thought we would do today is just walk you through sort of the process of coming in for a consultation at the dispensary. And again, really, again, this just talks about our operation where it's really a patient-centered care team from the top all the way to the bottom. We're very engaged with our communities, and one of our biggest commitments is really trying to break down the barriers to access of care for patients, as well as those that have been affected by the war on drugs. We do a lot of expungement clinics and things like that in the community. So we're really excited about those things.
Okay, so I'm going to talk about our dispensary care of process of care model. So what we do, it mirrors the pharmaceutical process of care that we usually see in retail pharmacies. We're going to collect the necessary subjective and objective information about the patient so we can understand the medical and medication history and the clinical status of the patient. We're going to assess this information and we're going to set up a plan, and we're going to help with the other healthcare professionals to set up the best plan for the patient with the patient's help. This is like more where the patient is involved in what they have to, in what products they're going to use and what symptoms they specifically have. It's very individualized. And then we follow up all the time within 1 to 2 weeks with the patient and continue that follow up as needed to increase the effectiveness of the medical marijuana. Okay. And okay, so medical marijuana medication therapy management. So we review the social marijuana history and other medical history, review current medication lists, symptoms associated with the diagnosis, patient treatment goals and concerns, medical marijuana education, strain diversity, ratios, formulations, dose, frequency, and safety precautions. And these are things we'll be going through this evening. Okay, so we're going to use my case as an example. So we're going to collect and assess the information from the patient. So my medical problem was I had breast cancer on the left side. It was invasive lobular, and it was estrogen and progesterone positive and HER2 negative. So my current medication list was venlafaxine, lisinopril, pantoprazole, zolpidem, and tamoxifen. So the venlafaxine is used as an antidepressant, lisinopril for high blood pressure, pantoprazole for stomach problems, zolpidem for sleep, and then tamoxifen for the breast cancer. So the symptoms I had that were associated with the diagnosis, probably the worst overall was the anxiety. And I think probably that touches everyone at one point or another when they're going through the journey. I also had some depression going on, some nausea, some sleep disturbances, and then good old hot flashes. So my treatments and goals, I wanted to use medical marijuana to treat the side effects of chemotherapy and the oral hormone blockers. There are different reasons people use medical marijuana, and we find they usually fall into one of three classes, where people will use a lower dose to help with the side effects from chemotherapy. You might see patients, they'll use a high dose in conjunction with chemotherapy in the hopes of a cure. And then we also see patients that use alternative medication and disregard conventional pharmaceuticals. And we're by no means saying that this is any type of cure. We are saying this is just quality of life, and it made a huge difference. And that's what we're gonna help patients decide what is the best for their specific need. Okay. So cannabinoids. Cannabinoids are produced by the cannabis plant. And when you talk about endocannabinoids, endo meaning within, so these cannabinoids are produced within the human body. There are also phytocannabinoids, and these are produced from the plants. They're in the resin or trichomes of the plant. So these cannabinoids, they're chemical compounds that interact with the endocannabinoid system. So let's talk about just what the heck is an endocannabinoid system. So let's go to the next slide. Okay. Oh, and does anybody remember this commercial from back in the 80s, and this is your brain on drugs? Well, that's what we have. A lot of people still have that stigma, and we're trying to get rid of that. So we just threw that in there. Okay. Okay, Terry?
So everybody wants to know, what is the endocannabinoid system? And really the picture of the egg and your brain on drugs is because back in the 1980s, we had the compound of THC, but we didn't even yet know what system that drug worked on. It's actually one of the first times that we knew we had a drug, but we didn't know where it was working. So the endocannabinoid system was actually discovered in 1988 by an Israeli scientist. So the question we get is, do I have an endocannabinoid system? Well, of course you do. All mammals do. And the endocannabinoid system is actually the largest cellular regulatory system in the entire body. So if you know or think about the skeletal system, the respiratory system, the muscle system, circulatory system, the digestive system, the endocannabinoid system kind of sits on top of all of those and helps regulate the entire body. It runs from your head all the way to your toes. It's really a network of receptors that work with the cannabinoids, whether it is the endocannabinoids or the phytocannabinoids. And its primary purpose is to maintain balance or homeostasis within the human body. So again, the endocannabinoid system is an internal homeostatic regulatory system that's involved in multiple processes. It's contributing to the modulation of pain, seizure control, appetite, mood, digestion. It really does. It helps maintain balance throughout all of the other systems. There are really three main components of the endocannabinoid system: the receptors, the endogenous cannabinoids, anandamide and 2-AG, and then the enzymes that actually degrade those endogenous cannabinoids. So we have these receptors, and if you think about the receptors, they're really like little docking sites, like a lock and a key, or Lego blocks that stick together. So the receptors are where the cannabinoids actually dock and then cause the physiological responses. So if our body is all out of whack, It's a natural release, so they're released on demand internally to basically come back in and bring things back to balance. A very simple summary. It's much more complicated than that. So in health, when we're healthy, the receptors of the endocannabinoid system can be stimulated by those endocannabinoids, the internal ones that our body produces. When we're in disease, the receptors oftentimes aren't able to be stimulated or sometimes are overstimulated. So the cells and the organs aren't able to function properly or maintain that balance or homeostasis. With a deficiency in the endocannabinoids, we're able to actually supplement our own bodily systems with the phytocannabinoids to help stimulate the CB1 and CB2 receptors. That would be the same as or similar to taking a vitamin D supplement or using a thyroid medication if you were hypothyroidism. So just think about if your body is in a disease state, your endocannabinoid system can be a little bit out of whack, and being able to supplement with the phytocannabinoids can really help bring you back to homeostasis. The reason why the plant-based cannabinoids work so well or work in this way is really because, in particular, the chemical structure of THC is very similar to that internal or brain chemical called anandamide. And because the chemical structure is so similar, the body is actually able to recognize THC similar to anandamide, and it can dock on those same receptor sites.
Okay, so the endocannabinoid system and cancer potential mechanisms of action. So when you activation of the CB1 and CB2 receptors by cannabinoids can cause anti-tumor effects in a number of cancers. So it can trigger cell death, prevent cell growth and division, prevent the growth of blood vessels that feed these tumors, and prevent cancer cells from migrating to other areas of the body. Okay. So the therapeutic effects, therapeutic properties of the cannabinoids. So the highest concentrations are found within the trichomes or the resin glands, predominantly on the female flowers. So we have listed here some of the more common cannabinoids and their properties underneath there. Was there another one, Terry, on here? Oh, here we go. Okay. So THC, the main effects of that would be you can get a euphoric feeling from THC, whereas you would not from CBD. So THC has anti-cancer properties, it's analgesic, antispasmodic, anti-inflammatory, appetite stimulant, antioxidant, neuroprotectant, antiemetic, and bronchodilator. CBD, on the other hand, is great for anxiety, also for anti-cancer, analgesic. It's great for anticonvulsant, antipsychotic, antidepressant, anti-inflammatory, antioxidant, bone stimulant, antispasmodic, immunosuppressive, antibacterial, and neuroprotective. So some of these properties you see on both lists, some you see, just on one, but it's a little bit of trial and error when you first start. We help you to narrow down which is going to be potentially the best product for you. Okay.
So when we look at medical marijuana, we really kind of look at it as a pharmaceutical stew in a way. We know that there's over 480 pharmacological entities within the plant itself, which is much different than pharmaceutical medication, which is targeting one receptor, one site, it's one drug. Some of the effects that we experience from the cannabis plant come from the cannabinoids, but also from a group of chemicals known as terpenes and flavonoids. So what are terpenes? Terpenes are the organic chemical constituents of essential oils produced by most plants. All plants will produce terpenes. Think about terpenes that are sort of responsible for the smell and also for the effect of what happens with the cannabis strains. So if you think about your perfumes or your cleaning products or your skin creams or anything that has a smell to it, is pretty much coming from a plant terpene. Each cannabis strain has a unique terpene profile, and the terpenes and the cannabinoids really work in synergy together to produce an entourage effect. And the terpenes also are known to have individual therapeutic effects. So the main terpenes that you'll find within the cannabis strains are myrcene. Myrcene is also found in cloves and citrus, musk, and herbal products. It's very relaxing and sedating. It's what is responsible for like the couch lock. It is what can make you feel sleepy. It's really good for spasms, pain, and insomnia. It's also an antifungal, antibacterial agent, has antiseptic properties, and it's also an anti-inflammatory agent. Beta-caryophyllene, that's also found in cloves and the hops, so like the hoppy beers. It is the one terpene that's known to activate the CB2 receptors, so it's a powerful anti-inflammatory agent. It's also really good for muscle spasms, pain, insomnia, and it's also an antioxidant. Linalool is like what's in lavender. So if you've ever had a lavender bath or gone and had a lavender products used at a spa or something like that, or use that as essential oil, you know how calming and relaxing that can be. So it's really good for stress, insomnia, anxiety, depression, pain, and it's also has can be used as an anticonvulsant. Pinene. Pinene is just like walking through the forest and you smell those pine trees. It really is good for focus. It can also help with alertness and memory retention. So strains that are high in pinene are really going to be, you know, kind of put you on point. It's also an antiseptic, it's an anti-inflammatory, and it's also good for asthma relief. So it's a bronchodilating. Humulene is an appetite suppressant. So it is uplifting. Strains that are higher in humulene are going to tend to cause less of the increase in appetite that you might experience from cannabis. So a lot of people always want to know, I need that in my strain. Like we can just pour it in there, which doesn't happen. But it's also really good for pain. It's an anti-inflammatory, antibacterial, and like I said, it does help to decrease appetite. It's found in like coriander, the herb. Limonene is one of my favorite terpenes. It's found in citrus fruits. It can help alleviate stress and increase your mood. So it causes an elevated mood, gives you a little bit of energy. It's also good for heartburn, GI issues, depression, and it does have antifungal properties. Terpinolene is another terpene that's common. It is an antibacterial, antifungal. It's good for insomnia when it is in a strain with myrcene and maybe linalool, and it's also an antiseptic. When terpinolene is kind of fun because when it's with limonene, it's also very good for cognitive clarity. So it can give you a little bit of an up. And I know terpinolene is one of Heather's favorite terpenes.
Yes, it is.
Bisabola is what's found in like chamomile tea. So it's relaxing and soothing, but it also has anti-inflammatory properties. You'll find it often in cosmetic creams because it can be it's an anti-irritant. It's also an antioxidant, and it's good for pain relief.
Okay, the cannabinoids and terpenes that we find that have the best potential for anti-cancer properties are the CBG, THCA, CBDA. And then the terpenes are the beta-caryophyllene, humulene, limonene, and myrcene. And one of the ways I try to tell people to think about your cannabinoids and your terpenes, think of if you have a band, okay, so THC is like the common thread in all of our products. So I'm going to say THC is our drummer. So it's going to keep the beats, it's going to keep the rhythm in the background. Then you have your guitar player and your bass player. So those are your other cannabinoids. So think of your CBG and your CBDA, and they're going to give you additional properties. And then your singer, that's your terpenes. You can have a lead singer that's going to belt out a country song, and then you have another one, it's going to give you a rock song. So depending on what terpenes and what kind of effect you want to get is what the different combinations you put together, or well, you don't put together, you look for that combination in your strains. So just kind of think of it as a band. Instead of just a drum sounds good by itself, but when you add the other instruments and you add the voice, you have the whole song and it sounds beautiful. So like 1 and 1 is not 2, it's 3. So, okay. Okay, sorry, go ahead, Terry.
When we look at choosing strains or products, one thing we look at is strain diversity. So within the cannabis culture and within the industry, we still classify strains according to an indica, a sativa, or a hybrid. That may not be the most ideal way to classify the plant, but it's still what we have. Ideally, you can look at the cannabinoid profile and the terpene profile to really more classify things on a sedating side all the way to a stimulating side. So the indica strains are definitely going to be more sedating. So think indica in the couch. They're going to cause that sleepiness, that couch lock effect, that heavy body feeling. And then as you move along the continuum or spectrum, to be more sedating, you're going to have the sativa. So think sunshine, stimulating. It's sunny out. I'm happy. I'm feeling good. I've got some energy. I want to go at it. And somewhere in the middle are the hybrids. And the hybrids are either going to be indica leaning or sativa leaning. So you have indica dominant hybrids or sativa dominant hybrids. So it's really the terpenes that help with the cannabinoids to really determine the effect of the different strains. And if you look at a menu, you'll see all kinds of crazy names on the menu, and you won't be able to make heads or tails of it. But if you look deeper, take a deeper dive into the terpene profile, you'll be able to see that terpenes that are going to be more indica leaning strains would be ones that are higher in myrcene, linalool, beta-caryophyllene, maybe bisabolol, terpinolene. Strains that are going to lean more towards being sativas are going to have much more limonene, beta-caryophyllene, pinene, terpinolene in them. So you can really, if you dive into get out of the strain name and look at the chemical makeup of it, you can really figure out which is going to be best for what you're trying to treat. So when we start to recommend products, one of the things that we do is really dive in and talk about how comfortable you are with feeling intoxicated in a certain level of psychoactivity. So as Heather mentioned about THC being the drummer, I like to say CBD and THC by themselves are one-man bands, and you put them together and they work much better together. So on the spectrum of products, you'll have THC dominant products, which are going to cause a lot more psychoactivity or intoxication or euphoria. But as you move towards the ratios of being more CBD dominant, you're going to have little to no intoxication. And as you come to the middle with a 1-to-1 ratio of equal amounts of THC and CBD, you can medicate without feeling intoxicated. Part of the reason why that happens is because CBD is an antagonist of THC in certain degrees. It actually bumps the CBD off of the receptor. And once it's bumped off the receptor, even though it's still working, it's decreasing that side effect of the intoxication. So the THC dominant ratios are obviously going to cause uplifted emotions. You're going to feel the laughter, have a little bit of dizziness maybe. Potential side effects might include some tachycardia, anxiety, paranoia if you take too much or too high of a dose. In a balanced product, you're going to probably find the most relief to start out with on overall all conditions. You might have a little bit of relaxation with very little euphoria or feeling any alteration. But you still have CBD on board, so you do have to experiment with that ratio. And then as you move into the CBD dominant, it's going to eliminate most, if not all, of the euphoria. You may have dizziness or other potential side effects of the THC, but they're going to be minimal. It's going to provide some mild sedation and definitely help with relaxation and all the other potential positive properties that it can target.
Okay, so the ratios in breast cancer care. So we're just going to talk about like the three main classes. So in the hormone positive, you usually want to use a 1:2 ratio, like a 1 THC to 2 parts CBD, and then slowly increase THC as needed. They're found that the ID1 gene that causes cancer to spread, CBD may inhibit this gene and stop metastasis. So THC may activate receptors to kill the cancer cells. So in hormone sensitive, you want to use a lower THC and slowly increase. In the HER2 positive, preclinical studies are showing that THC is working very well. Start with the 1:1 ratio as well. But in here, the HER2 protein binds to the CB2 receptors. So that's going to cause the cancer to grow. So we're finding that if you give the THC, it bumps that protein off of the receptor. So it tends to be like a higher dose of THC seems to be a little bit better in this group, but go slow and slowly build up. And then in triple negative, there's no targeted treatment. So we believe, start with that 1:1 ratio to start and then increase your THC. But this looking like a lot of potential in triple negative because the potential for the CBD and THC to cross the blood-brain barrier and to get into where it actually needs to work. So we're seeing a lot of potential here. Hopefully a lot of good things coming down the line with it. So proposed mechanism of action of cannabis for breast cancer. So CBD mediates breast cancer cell death, inhibits the survival of estrogen receptor positive and negative cell lines, interrupts the inflammatory cascade. It will switch off the genes responsible for metastasis in the triple negative aggressive form of breast cancer, turn off the overexpression of ID1. CBDA inhibits migration of human breast cancer cells. CBD has the ability to switch off the DNA that causes breast and other types of cancers to metastasize. THC has been shown to induce cell death in some positive breast cancer cells and inhibit tumor growth in animals. And CBD inhibits the angiogenesis, the blood. I can't think of the word, Terry. What's the word I'm looking for?
It attaches to the surrounding tissues.
Yes. Okay. By multiple mechanisms. I cannot think of that word. Okay. So potential benefits of medical marijuana with cancer. So we're going to help treat both the chemotherapy side effects and potentially the cause of cancer. So it helps cancer patients treat pain, inflammation, nausea, and wasting syndrome, improve the quality of sleep, reduce anxiety, and reduce neuropathic pain. So the method of administration is going to vary by individual, and it's going to be what you're most comfortable using. Short-acting products, that would be like the vaporization products, dry leaf, vape pens, and concentrates. We have longer-acting products like tinctures and sprays, full extract cannabis oils and capsules. And then we have topicals and transdermals. So those would be creams, ointments, and salves. So there are a lot of different individual factors that influence the method that you want to use. So it would be physical constraints, your medical history, your affordability, and the dynamic product inventory, because the things cycle around. Like the flowering season of the plant might only come around every so many months. So we have to wait for that product to come back into inventory. So you might have to look for products that have the same terpenes in them. So that's why we say use different methods, try different things, and layer your products so you're never out of anything. You have multiple go-tos.
Okay, so
Okay.
when you come into the dispensary, the products that you'll find on the shelves are, these are the approved products in Pennsylvania. Capsules and tinctures, those are both longer acting products. The capsules will work in about 90 minutes and the effect will last about 6 to 8 hours. The tinctures, their onset of action is a little bit shorter. They'll work in about 15 to 45 minutes, while their effect will last anywhere somewhere between 4 to 6 hours. The tinctures are oils that go underneath the tongue by drops. The faster acting products would be your concentrates, your dry leaf, and cartridges. Those are all vaporizable products. The dry leaf is obviously from the flower. It's used in a dry leaf vaporizer. The cartridges are pre-filled cannabis oils that have been extracted through various mechanisms, and they attach to a battery. So the cartridge and the battery then become the vape pen. And concentrates are just similar to the cannabis oils, but they are concentrated forms such as batters, waxes, shatters, butters. And basically it's the consistency of the term, the word, of the product. And those are just concentrated, super concentrated cannabis products. The distillates and RSOs are cannabis oils. The RSO is definitely more of a plant-based oil. It's a thick, tarry substance. And those are dosed orally. You can also use them for cooking in the case of a distillate. Their onset of action is going to be anywhere between 90 minutes to an hour and a half, depending on how you metabolize them. And then the effect is going to last somewhere to 6 to 8 hours. And then there are topical products, which are your transdermal topicals and transdermal ointments, creams, and salves. Those can be used as many times or as often as you need them throughout the day, just to find relief. We kind of talked about this already.
Yeah,
of administration. So some of the benefits, the capsules are long acting, so it's a long acting product that you can use throughout the day or for in the evening for sleep. On top of that, you can use a shorter acting product like the vape products or the skin transdermal ointments, really to help with more acute symptoms. So if you think about the capsules as kind of a long acting, even pain pill, and then the vape products as more of your short acting pain relief or anxiety relief, whatever that may be. We always say, and you'll hear us say 10 to 20 times, if not 100 times a day, start low and go slow. I always use the analogy of it's better to put multiple layers on the cake than it is to try to ice a warm cake. The goal is always to establish the minimum effective dose, so the least amount of product that you can use at the most benefit in order to prevent the unwanted side effects. Obviously, we want everybody to experience a positive therapeutic outcome. If you come into the dispensary and maybe haven't had a consult or talked to one of the patient advisors, and you go home with your tincture and you take a whole dropper full and now you just sleep for 12 hours, you may not have a very positive experience and might not come back. So we really want that education piece to be part of everything we do. We do look at things when we're helping to choose products such as tolerance, whether you are a new consumer or whether you have cannabis experience, also drug interactions, and what is your desired effect. So would you like a little bit of euphoria? Would you like to feel a little bit happy or not? Not that you can't be happy without it, but. Cannabis is one of those compounds that has a biphasic response. I'll give an example of another drug, actually, alcohol. Alcohol also has a biphasic response. So at very low doses, you want to titrate up slowly until you get to the area of the green where you have sort of found your sweet spot. Because at higher doses, if you take too much too fast, you actually saturate the cannabinoid receptors, and then you experience the side effects, maybe the dizziness, maybe the upset stomach, maybe the tiredness. Alcohol is very similar, where 1 or 2 drinks might make you feel pretty good and a little giddy, but if you have a 6-pack or a 12-pack, you might feel pretty sick the next day or within a couple hours. One of the conditions that we're real sensitive to this biphasic response is anxiety. So at high doses, THC can stimulate the fear center of the brain, and then when that happens, start the paranoia. And then if you have a strain that just so happens to have too much pinene in it, now you're stuck with a focus factor as well. So you're maybe trying to go to sleep, you've taken too much cannabis, and it has some pinene in it. So you're laying in bed, you're so tired in your body, but your mind won't stop racing. So low dose THC is really good for anxiety. High dose, not so much. You experience that biphasic response.
Okay, so dosing. The typical effective dosing of THC, we consider anything under 7 milligrams to be a low dose. A medium dose will be anywhere from 7 to 18 milligrams, and a higher dose is above 18 milligrams. So there is a known tolerance to THC via the downregulation of CB1 receptors with chronic use. So patients may have to use a higher dose, but can desensitize the receptors by stopping for 2 to 3 days. And that's what we usually call our tolerance break. So you'll reset your receptors and be able to start it again at a lower dose. It's in the red box up in my closet. Okay. Okay, so I'm sorry, my computer it's beeping that it's going dead, and my daughter's like, I can't find your charger. So dosing to minimize side effects of cancer and conventional treatment. So for chemotherapy-induced nausea and vomiting, appetite stimulation, nausea, pain, usually I recommend to people start, at a low dose. If
I think we lost her. If you want to take over, Terry.
Yeah, sure. So usually we recommend that you start at a low dose and then you titrate that up slowly. The question is, how do I know that I'm at a good dose? Well, it's usually when you don't have symptoms. And you can achieve that usually over the course of 7 to 10 days of slowly titrating up the product, or slowly increasing the number of maybe inhales you do on a vape product until you get to the good dose. With the strains, we always recommend to avoid pinene if you do have that anticipatory nausea that can come with chemotherapy. And also important to note that pinene and humulene also have antibacterial and anti-tumor properties. So some common adverse effects, and before we go through them, and we probably should have asked before we even got to the slide, but so if you think about some of your medications that maybe you've taken in the past or even now to maybe treat the nausea, to enhance your sleep and things like that. When we look at the side effects, then we hear things like dry mouth, red eyes, tiredness, dizziness. You can also have those same side effects with prescription medications, obviously. So you can see some of the common side effects, which I'm sure is not of any surprise to anybody, but the red eyes, dizziness, bronchitis is probably more from irritation from smoking a product, which, as we mentioned, is not a preferred form in Pennsylvania. You can have altered sense of time, reduced tear flow. That's because of the THC can cause the dryness of secretions, which can be good in some diseases, not so much in all of them. Dry mouth, decreased sperm count, slow pupillary response to light, sedation, reduced coordination, cough, just basic confusion. Some of that is also very common for many, many prescription drugs. There are some special precautions and warnings in certain populations that we will maybe pay more attention in sort of the warnings. And all of these are found on the safety inserts that come with each product that's dispensed in Pennsylvania. So pregnancy, breastfeeding, heart disease, perhaps a weakened immune system, lung disease, seizure disorders. So THC and CBD are both good for epilepsy, but THC can actually potentially trigger the seizures if you're not used to using it. And then surgery and mental illness with a history of schizophrenia. There's been a lot of research done through the National Institutes of Drug Abuse to, kind of look at the mental illness piece. So their job is to always find something wrong, not to find it right. One thing that's important in that category, though, is that if you're going for surgery, you do want to try to stop using your cannabis at least 2 weeks prior to the scheduled surgery. There's been reports showing that you might need to have an increased amount of anesthesia if you are still consuming prior to surgery. So frequency, we really, just like any other medication, so what are your symptoms, how often you have them, and how often do you need to treat them? So it could vary from once a day to twice a day, 3 times daily, or as needed. It really just depends on your individual goals and your individual effects. So if I just am experiencing maybe anxiety and I really have that prior to treatment, then maybe I would just use a vape pen prior to going. If I have a rough time sleeping at night, then I might use a long-acting indica dominant product just for nighttime. Some people, like on chronic opiates, may use it 3 to 4 times a day to either bridge the pain medication, so use it in between the pain med doses, use it in place of those pain medication doses, or use it with it to make it a more intense pain relief. So we generally try to recommend that we layer products, have a long-acting product on board, and then use a short-acting product for more acute episodes. Again, so part of the consultation at the dispensary is really an action plan that includes dosing and some suggested titration schedules. And again, always start low, go slow. Less is often better than more. Again, start low and go slow. Practice takes patience. It can take 2 to 3 weeks to find that sweet spot. We always really try to caution individuals about that. A lot of people have a misconception that I'm just going to go home, I'm going to take a drop of this and I'm going to feel great. No, we're going to have to build it up to get that, find that sweet spot for you. We encourage everybody to track their symptoms and summarize the results weekly. Weigh the results when you're deciding whether you're going to increase your dose or not. Is your symptom better or is it worse? And then how do you choose? Am I going to increase it or not? Well, if I increase the dose from yesterday's dose and now today I'm feeling really tired and woozy, the good news is that tomorrow or the next dose I take, I can just dial that back a couple drops and come back to balance again. So we really try to help people decide and understand when to increase and when to stay, and when to know when to stop making changes. This is just sort of an example of what our dosing and titration worksheet might look like. They'll give you an opportunity to rank your morning or your symptoms on a scale 1 to 10. What dose are you taking? And then a couple hours later, really examine and hone in on what your relief rating is. So are you getting any relief, yes or no? If the answer is yes, then stay at that dose. If the answer is no, then increase it the next day. This is just some example of additional written product information that we provide. Just again, when you come in, understanding that it's so overwhelming and there's so much information, you might be scared, you might be going, I don't know what to do. She just told me so much stuff, I don't remember anything she just said. At least we're going to send you off with some recap of what you just learned. And this is just an example of that. Same thing with the tinctures. And then we have a similar thing for the capsules. We really do encourage everybody to use a dosing log and really, what was the strain name? What percentage of THC and CBD was it? How much did you take? When did it start to work? How long did those effects last? And then did you have symptom improvements? Did you have any side effects? And notes like what was your terpene? Maybe what was the terpene concentrations or the different types that were in that product? Just a couple tidbits. With cannabis and THC, it's great to take with healthy fats. It actually increases the absorption, maybe some avocados or almonds. For normal prescription medications, you want to separate your medical marijuana dose by 2 hours just to try to avoid any potential interactions. There's always a difference between an experienced user and a naive user. You're going to have different expectations of the benefits and the risks. So if your friend down the street says, oh, I use this wax, you should try it. If you're new to cannabis, you should probably not try that. It may be just way too strong for you. Generally, the whole plant is much more beneficial than isolates. So you'll see CBD isolates or THC isolates. The whole stew altogether is probably better than individual components like we talked about. It's really important to remember with cannabis as medicine that it's not one size fits all. It's not your traditional take 5 milligrams in the morning and then call me if you have any problems. It's really personalized medicine, and that's really the biggest benefit, in my opinion, is it puts you in control of your dosing. It puts you in control of your health. Do I need it today? Yes or no? Do I have to take it? Yes or no? The addiction potential is very low. Potential for overdose almost is non-existent. So it's a safe alternative or additive. So potential, Heather, are you back there?
Yeah, I'm here, but I just can't see me. Okay.
Oh, good. So you're on potential drug interactions.
Right. Okay. Potential drug interactions. So this is something I came across when I was looking at my own history here with tamoxifen. That is called what's considered a prodrug. So in your body, you have to actually break it down into its active form to work. Well, it turns out THC and CBD, some of these cannabinoids, use the same pathway that you're going to use that activates your tamoxifen. So you don't want to potentially use those two right together because that interaction, and your tamoxifen is not potentially going to work as well as it might had you used it alone. So that's one of the warnings we tell people, definitely check with your doctor if you're going to use your tamoxifen, separate them. There's also things like certain antidepressants. Let's see, which ones were they here? Not antidepressants, certain antibiotics, certain antibiotics, certain antifungals will also go along this pathway. So there are not really many drugs, but it's always good to let us know what you're taking so that we can run through those drug interactions for you. Okay. Oh, there it goes there. The amitriptyline, I said, like diazepam, warfarin. So those are potential things to look out for. Always alcohol, benzodiazepine, opiates should definitely be separated because of the potential additive effects of both of those together. So here we go. Separate your dose by 2 hours. Monitor warfarin interactions. We want to educate patients on the additive risk. Select products based on the cannabinoid ratios that are most applicable, and start low and go slow.
I think we're getting
yeah, this we just included in case we would need it. I don't think we really need that. Yeah, we don't really need that one either. These are just if anybody had any questions about them. So as far as following up, patient feedback is so essential. We want you to maintain a dosing log, track your symptoms, and bring it with you to your following appointment the next time you come in. Journals are great to keep, evaluate the strains, and when you get your product, it's going to have a label on it that's going to give your percentage of THC and CBD, and it's going to list a lot of your terpenes that are in there. You should always keep your package with your product to begin with legally, but keep those with you, and then you can keep that in your logbook and see what your terpenes are actually working best for you. You keep track of those. We follow up with patients, within 7 to 10 days after starting therapy and as needed afterwards. But things always come up, questions you don't think of when you're there initially. Write them down if you think them, put them in that journal. And next time we talk, then we'll go over them. We like to include the physician in assessments, and then the patient care cycle continues with updated recommendations as needed. Okay. So these are from some studies that we found that actually give really in-depth different cell lines. So just in case anybody wanted any information about those. Okay, and any burning questions? So I didn't know, do you guys want to, I don't know why I can't see me, but do you guys, or you want to go over what the products look like? Are you guys familiar with like what an RSO or syringe or vape pens or things?
You know what, Heather, I think it might be wise because I know you got this presentation is absolutely phenomenal. The information is just, you did a phenomenal job, but I know there are a lot of people here that have questions. So
Oh, okay.
we can get to that. I think that would be really great.
Okay, perfect.
And I think you just have your camera off. So if you look at the bottom of your left-hand bottom of your screen, where it says video, you can turn your video back on. There you go.
Okay, there I go. All right.
There's that. So if anybody wants to put their questions in the chat, I think that's probably the easiest way. Jen, do you have any other suggestions, Erica, for questions, how we could go about this?
There's already 2 questions in there, and then someone emailed me a question. So yeah, that's probably good.
Okay, so the first question, I'll read the chat for you here. If you is, where am I? I have an entire, is that the first one I have here? Yes.
Yeah.
I have an entire drawer of marijuana that I'm afraid to use because PA still has DUI laws that apply to marijuana. When will we be able to use them?
Yeah, we're by no means like experts on the law, but you should never use your product and drive, never use machinery, things like that. You always want to be safe, but usually your effects wear off within the allotted number of hours. So you should be able to effectively work or do what you need to after that time has worn off. Unfortunately, in the state, they don't have levels like they have alcohol levels right now, but there are groups that are working on changing that.
Okay. Second question is, if she asked, how do I contact someone to decide what might be best for me, and how would I get a medical marijuana card? And do you need a card for CBD?
Okay, for the products that are in the dispensary, they all have THC in them. So if you wanted CBD, it would have at least a little bit of THC in it. Those products you would need to have a medical marijuana card for, anything you come into the dispensary for. But CBD in the dispensary does differ a little bit from things you see in like gas stations and over-the-counter products. You always want to make sure you have a nice quality certificate of analysis that tells you where your product came from, if it's been tested for different chemicals, that sort of thing. So make sure you have one of those to make sure you have a quality product. The dispensary stuff is all tested. Everything in the dispensary is tested before it goes out to the patient. And we do have all those levels that will tell you, how safe it is and what exactly is in it. Oh, and how you get a card. In Pennsylvania, you go on the Pennsylvania Department of Health website, and you would register as a new individual for a medical marijuana card. You would see a certifying doctor, and there are lists under there. And if you call us, we can also recommend doctors as well. So you get your certification from the doctor, you pay your fee to the state, and then they will mail your medical marijuana card to you. So we recommend people, before you come down, give us a call. We used to do in-person consultations before the COVID came around, but we see we'll probably be going back to that again. Give us a call. We'll go through the list of what we have on inventory, find the best product for you, and place an order for you before you come down. But that doesn't mean you can't ask questions when you come in, and we can go over things briefly with you as well.
And then do you need a card for CBD?
Yes, for the dispensary CBD you would. Because all of it does have THC in it as well. So you would have to have a card to buy it from us.
Can you talk about the possible CBD interactions with tamoxifen?
They are talking about CBD and tamoxifen. Tamoxifen is what I was calling a prodrug. So you need to go through your liver to be activated. So CBD and THC go through your liver to be metabolized and your body to get rid of it. So if they're both going through there, and the CBD and the THC are using the enzymes that are needed for that tamoxifen to be activated, it can't become active. So you have that prodrug just floating around in your body and not really working. So if you separate them, and then your enzymes are then free to activate your tamoxifen so it can work. It's a little complicated, but it has to do with the liver enzyme. So if we find that if we separate them by 2 hours, that usually will be enough to do the trick. So just make sure you separate your medications.
Somebody asked, how should I consult from outside of the state?
Get a consult. I'm sorry, I didn't hear the end of it.
How should I get a consult from outside of the state?
Outside the state? Well, each state has their own medical marijuana programs if they have them set up. It's best to find out who is running your medical marijuana program in your state and find a dispensary. And usually most of them have pharmacists or healthcare workers on staff that can definitely go through things with you.
Right.
And I'll just add to that, Heather, if you find, especially for members of the organizations that we're with today, if you find that you don't have any resource like that in your dispensaries, I've done it a couple times for folks where they let me know the name of the dispensary that they're going to utilize from whatever state they're in. Like my girlfriend from California, we went through and she gave me the name of the dispensary. I looked up the menu and we actually were able to choose products that would benefit her, just like we would here. So we're happy to help anybody do that.
Right. And we'll provide our email and information if anybody needs to get a hold of us afterwards.
Sounds good. How much does it cost for a consult?
Nothing. The consults are free. You can ask as many questions as you want. That's what we're here for.
That's right.
What are the common ingredients in the tincture base, and do tinctures affect oral membranes?
I believe most of the tinctures we have now, they used to have some alcohol based, and I think they've discontinued most of those now because they cause so much burning. Most of them are coconut oil, MCT oils now. So if you have a coconut allergy or something along those lines, we would be hesitant. We would tell you to be careful, try it a little bit at a time to see if you have any reaction. Other than that, though, we haven't had any other problems. Terry, anything you can think of with the tinctures?
No, not really.
No? Okay.
Then can you explain concentrates, wax, shatter, etc.?
Okay. I have a jar here I can show you. It's waxes, shatters, things. They come in little small jars. Some of them look like sand. They might look like a piece of glass that you can break into pieces, but their consistency is different. So a shatter is going to look like a piece of glass. If you hit it, it will shatter. Sugars look like a wet sugar you might have in your kitchen. Almost like a lip scrub also too. So it's just the different consistencies, but with it, you would use that in a pen or a dab rig, or you would use it, you would heat the product and then you inhale the vapor from it to get results within 5 to 10 minutes. It's a very quick process.
Okay, great. Are the cost of your products online, or do you have a website?
We do have them online at our website. They vary depending on what you're going to use, but things can run anywhere from, $30 and up, depending on which method you use, how often you're using it, very individualized. But we definitely take into account affordability when we go through things with people.
Hello, can you hear me?
Yes.
Okay, hi, it's Libby Zal. I also wanted to know, I know you were going to do a raffle and some discounts, which would make a big difference when you do discounts. So when will you be doing that?
I think we'll do that at the end, Libby. We want to finish the questions, and I think Erica will get to that. So good question. Good thing to bring up, Libby.
Right.
Couple more questions. Is it routine for the doctor to have you come in every 3 months for a urine test?
We
No.
do not do that, no.
So I'll talk.
Okay.
I'll address that. So
Okay.
every physician, certifying physician, is going to take care of their patients a little bit differently. Some of the physicians do have their patients come back every 3 months. They may have them do a urine test, and that is really no different than if they were on a long-acting or short-acting opiate and their prescription is up in 90 days. They would have to go back to the provider's office to get the prescription, and in most cases they would have to do a urine test. So it's not really, it's really the physician's process of care. So it, in my opinion, is no different than if they were being prescribed any other pharmaceutical medication for their treatment.
Okay, thanks. And then what type of products are whole plants?
Whole plants, you got that, Terry? Okay.
No, go ahead, you go.
No, I was gonna say, so whole plants, when you were comparing things like a Rick Simpson oil, the RSOs, it hasn't been, it's more of the pure plant itself. You have all parts of the plant are contained in there. So you have your cannabinoids, your terpenes, without stripping, how you want to say that, any of the good stuff out. Is that about how you would, best way to describe it? Okay.
And then is there a big difference between tinctures and RSO?
The difference are going to be in the time it takes for them to start to work and in the length of time they last. So tinctures are going to start to work faster, and they're also going to not last as long. So the longer it takes for something to work, the longer it usually lasts. So your RSOs, you're going to get, you're going to maybe need an hour and a half to 2 hours for it to start to work, but you're going to get maybe 6 to 8 hours of an effect out of it, where tinctures are 30 to 45 minutes, and you might get 4 to 6 hours results out of those.
Okay. And then I have a couple questions too. As far as weaning off, and I know you had that picture there, if you have to wean off even for surgery, like you mentioned, which I've never heard of, that was really useful information. Is there a time limit, or do you wean off in a, you taper it, or what is the suggested, way to do that?
Some people do get a little bit of say like some anxiousness almost if they stop cold turkey with anything. You figure that even like nicotine, things like that will cause that. It's not something that I think is detrimental at all to anyone's health. You don't have any risk of like any respiratory problems. So I have to admit, I didn't stop until the day of, but I did let the doctor know that I had used my product, and I did have to, I believe they had to use extra anesthesia, which afterwards really stunk because then it took so much longer to wear off. And I felt, sicker because of all that anesthesia in my system, which I wish I would have listened in the first place. And, I wouldn't have run into that. So we all learn, we learn the hard way, but I'm telling you, listen.
And a couple other questions. How much do you recommend using it in conjunction with antidepressants and anti-anxiety meds? I know that you said to take them 2 hours separately, but are they helpful? Do they work together? Do they sometimes work against each other? I mean, what's your suggestions?
I have not had any problems with using antidepressants with any of the cannabinoids, any of my marijuana products. If anything, I find the limonene in it to be very helpful for me as almost an antidepressant type of effect, used for my anxiety. So it really has, the terpenes really have a lot to do with the effects you're going to get. I would just, sorry, I got off track. I'm sorry, I got off track. I lost track of the question.
That's okay. Just, the mental health part of it, I guess, from my background, because I have a lot of people come to me that have mental health issues and that are using anti-anxiety meds and antidepressants, and they benefit from using medical marijuana. And I'm just curious, do you work with the clients to be able to kind of, balance that and work with their psychiatrist if they're getting their meds from that psychiatrist to kind of, make sure they're getting the right doses of both,
Right. We tell people don't just stop any medication, any prescription medication without consulting a doctor first. That's something we definitely want to find your dose of medical marijuana and then start talking about decreasing it. We want to work in conjunction with other healthcare professionals to do that. We don't want to do it on our own.
Sounds good. Sounds good. And then the last question is just, do you, when you're doing screenings, are you screening out for mental health? Are you referring people out for counseling as well as just for, the medical marijuana? Because even with, when we have people go on antidepressants, anti-anxiety meds, that's just, it's a part of the solution. But I was curious way back a few years ago, whenever medical marijuana came out, we had Dr. Donner spoke to us, and I asked him that question, and he said there would be screening, but I do know the people that come to me that say that they haven't been asked, or referred to a therapist. I'm just curious what you guys personally do at Maitri to screen for mental health and make referrals.
Okay, Terry, do you want to grab that?
Sure. So one of the questions that we ask, and again, it's on the consult form, we ask if you have any, history of schizophrenia in your family. Do you have any, bipolar or depression problems? And then also we ask a whole host of questions about the symptoms that you're trying to treat. One of our number one qualifying condition that we see at this point in time, especially with the pandemic, is anxiety. And that's pretty much system-wide across the state. The number one qualifying condition used to be chronic pain. It's now anxiety followed by chronic pain, followed by PTSD. So those, I would say 80% of our patients have those qualifying conditions. We refer if somebody presents like they need help. I don't know if that's the right way to say that. We have resources that we can certainly send people to. A licensed clinical social worker in Uniontown, Perced in Pittsburgh. It just is a whole host of community partners.
That's great. That's good to hear. It's nice that you have people to refer to for sure. That's awesome. Sounds good. Anybody else have any other questions? These are all questions that you're all, posing. And, Sounds good. Erica, you want to?
Yeah, if we've got no more questions, I just wanted to give a big thank you to Heather and Cherry from Maitri Medicinals for coming on and having this amazing presentation. You know, you think you know so much because you use it, and then you see things like that, and I've just learned so much. So thank you for sharing with us. I know at least one person will benefit from this. So thank you. And then also thank you to Wendy and Jen for helping me put on my first Zoom call. And thank you all for your patience with the technical difficulties. This was our first one doing it together, so it went much better than I would have anticipated. And I forget who asked about the giveaway and the code. We will do all of that via email, so that way, whenever we send out the recording, it won't be on there, so not everyone can use it and take it. And then we are giving the giveaways to the 4th person who got on, the 20th person that got on, and then the 27th. So keep an eye on your email for that as well. Other than that, everyone have an amazing day, and thank you all so much for joining us.
And if we don't have your email, please, please reach out to us, because I know there are a lot of people on here that just say iPhones and iPads, and we won't know where to send that discount to if we don't know who you are. So please reach out to, Erica or Jen at the Cancer Caring Center to let us know who you are, so we can give you your discounts. Thank you all very much. Thank you, ladies. Fabulous job.
All right. Thank you. Take care.
Thank you.
Bye-bye.